Madam Speaker, my question is for the Minister of Health and Wellness. Last week, it was reported that 3/4 of the rooms on the healthcare floor of the Bridge shelter are sitting vacant. Meanwhile, there are hundreds of people experiencing chronic homelessness in Halifax, many of them with serious health issues. We know that there are staffing issues at the Bridge and across the whole healthcare system, but how is it possible that this government is allowing shelter beds to sit empty in the middle of a housing crisis?
I recognize the Honourable Minister for Health and Wellness.
Thank you, Madam Speaker. So we are in a partnership with Department of Community Services with the Bridge to support individuals experiencing homelessness who may need health care. So our portion of the Bridge is to look at those folks who need a space to get community-based health care, and so we look at the ability to prescribe periods of time where people can be sheltered in order to get that care, make sure that it's safe for both the individual receiving care as well as the person who's delivering care. So we continue to work with our partners in HRM to make sure that those spots for people requiring health care at the Bridge are used appropriately. Thank you.
I recognize the Honourable Member for Dartmouth North.
Madam Speaker, that sounds excellent. That sounds great. That's exactly what we thought that part of the Bridge shelter was for, and yet 3/4 of it is sitting empty. Meanwhile, there are people on the streets with severe health problems. People who are being released from the emergency departments out into homelessness again instead of to that area. A spokesperson from Nova Scotia Health stated that, quote, on any given day there are multiple homeless community members that are identified as people that would benefit from intake on this floor, and I can table that. Despite this fact, there are already more names on the floor's wait list than there are rooms. Madam Speaker, people are awaiting surgery, people using wheelchairs are living rough in this province. How does the minister plan for all these people to be safely and appropriately housed before winter?
I recognize the Honourable Minister for Health and Wellness.
Thank you, Madam Speaker. So as I said, we work across departments to find solutions for individuals based on their circumstances. So the Bridge is used for people who require short-term care in community who are experiencing homelessness. Unfortunately, it is not a long-term housing situation for them, but we do work with our allied healthcare professionals such as social workers and other individuals in the healthcare system to support transition to community for those that need additional support.